with lived experience who really we want to follow behind, and how we treat each other, how we care for one another in our communities so that we can deliver good care. And then also to evaluate the impact of stigma, implicit biases that if we can overcome and learn from every day, can expand our knowledge base and help us to provide better care. Next slide. We'll have our introductions, we'll meet our panelists, and then we'll hand it over to Ash and Chelsea to share with us doula's role in perinatal care. And prior to that, we'll also hear about Marjorie's lived experience recovery journey as a mom and throughout her perinatal journey. And then we'll let you know what's coming up for October. Next slide. And as we go, if you have a question, please put it in chat. We're really wanting to know what has made a difference in your community with a relationship you've seen, a bridge that the doulas have, a doula has built for you, for someone you know, or within your community. What challenges do your programs currently face? What questions do you have for the panelists, either for the doulas or for Marjorie, who works for a peer service organization? And then if there's anything useful that you've heard that you want more information about, please also enter that in chat. Next slide. And here are our wonderful panelists for this morning that I introduced a few slides ago. Thank you so much for giving us your time, and more importantly, for the work that you're doing every day. Next slide. Marjorie's going to be spotlit here, and thank you so much for giving us your time, for telling us your story, and for just being willing and open to empower others to also share theirs and help one another. So Marjorie, I'm going to turn it over to you.
Thank you, Maria. Good morning, everyone, or afternoon. My name is Marjorie Drew. I use she, her pronouns. And as of yesterday, I've been in recovery for 4.5 years. I'm in recovery from heroin and methamphetamine. And on May 6th of 2019, I got arrested on 2 felony warrants. I was taken to the King County Jail in Seattle. And I let the nurse know that I was going to be heavily withdrawing from opiates. And so then the process is they drug test you to make sure that that you're telling the truth. And so the nurse drug tested me, and she came back and told me that I was pregnant. I didn't believe her at first, and I was just so shocked. I had been using drugs heavily for about 8 years, and I didn't know yet that this was going to be the turning point for me. So to give you all a little bit background, I was born in France, and I lived there for 7 years, moved to Ireland for 3 years, and then I moved to the States in 2003, and I was 10 years old. So my youth, I had pretty much a relatively happy childhood. I was surrounded by family most of my life, and when I was maybe 4 or 5 years old, I actually was sexually abused by a neighbor's kid in France. And I really withdrew at that point, kind of from life. And so my mom, she had me go see a therapist. And the therapist at that point said, it shouldn't affect her. It was a one-off kind of thing. And she's like, she'll probably forget about it. And I did. I repressed it for a long time. And then it actually came back to me in a dream when I was 17 or 18 years old. So that kind of did a number on me. But prior to that, so everything was fine. I did kind of forget about it. It was probably back there in the subconscious of my mind. But looking back now, I can see how it played a role in my lack of feeling like I belonged, right? We left France, well, like I said, when I was 7. And that was really challenging because all of my relatives, I'm full French, right? On both sides of my family, my mother and father, my grandparents, everybody was in France. And so we moved to Ireland where I didn't know the language. They speak English, they teach Irish in school, but I didn't know the language. And I was ripped apart from my close family. There wasn't much contact with them after that, but so trying to get used to being in this new country and you don't know the language and you're very young and I have a distinct memory of my brother and I were at recess one day, and it's so vivid, right? All the kids are surrounding us outside and they're asking us questions, and I'm doing my best to answer. And I answered a question wrong, right? I thought that they asked me something and they didn't ask me that. And then they all laughed and they're pointing and laughing. And that might not be exactly how it went down, but that's how it stayed with me. And that was kind of the first feeling for me of not fitting in. And that kind of carried through the rest of my life. So we moved to Ireland we were there for 3 years, and everything was going well. I learned the language, obviously. And then 3 years later, right, I've made all these friends, and boom, we're moving again. My father worked at Microsoft at the time, and so he got relocated to Washington, and then we came here. And so I moved here in 5th grade, and it was a huge culture shock. I really felt like all of the friend groups they happen early on, maybe kindergarten, preschool, 1st grade, what have you. There's these close knits of friendships, right? That I was trying to integrate and be like, where do I fit in? It didn't really work. There was still this barrier for me of where do I fit in? Where am I comfortable? And then when I moved here, I had a very thick Irish accent, which kids in 5th grade can be cruel. And one time they asked me my name, right? And same thing, and I'm spelling my name out. And I remember in Ireland, the letter R, right? It's or. And so I'm like, M-A-or. And again, right, this laughter of you're different. You're a foreigner, you don't belong, you don't fit in. So it was hard making friends. My brother and I so he's 3 years older. So he was at a different school when I was in 5th grade, right? He was in junior high. So I didn't have him to kind of cling to. Get through elementary school, get to junior high, and I was very, very heavily involved in gymnastics. I did gymnastics for 10 years of my life, competitive gymnastics, and it was my passion. I lived and breathed gymnastics, and it was very much an out for me. It was a way for me to put all my frustrations and all of my problems, right, into my gymnastics, into my athletic career. And I did that. I also used to struggle with, I was heavier, and again, kids, right? So I got bullied. I got bullied because of my weight. I got bullied because of my accent. It all centered around this feeling that I couldn't get past of not fitting in. But I had gymnastics. And so my whole junior high, my whole high school career, I performed, right? And I competed. I was on 2 teams. I was at the gym Monday through Saturday. And I had these plans. These plans started to happen for me. And I was like, okay, this is where I fit in. This is where I can find my joy. So junior year of high school, I start making plans, and I'm looking at colleges to go and compete in. And then all of a sudden it felt like I peaked, right? And I wasn't getting any better. And I'm like, is this an age thing or what is this? And I started having problems with my back and just always in pain. So I went to a sports medicine doctor, and my senior year of high school, I was diagnosed with 2 chronic stress fractures in my lower back, and that ended my gymnastics career. And it broke me, right? It broke me. Um, I went from so much dedication and so much time into this, and it's taken away from me. And now what do I do? Right? I am not getting any better. I don't feel like I fit in again into this team because I'm not bringing my full to the team. So I had to get off the team for health reasons. And I now had all this time on my hands and I didn't know what to do with it. Still struggling with the fact that I don't fit in, right? And then I graduated high school. I did manage to do that. And then about 6 months post-graduation, I meet a guy. And this guy does heroin. Now, I'd smoked pot a couple of times, never really got into it, but I was curious. And I didn't know enough about it to know the addictive portion of it and to know really that like heroin is, why would you do that? So about 6 months after I graduated, I smoked heroin for the first time. Don't remember much of it. Smoked heroin again, a second time, maybe a few days later, and it was off to the races from that point. I hit what's called the NOD. Everything felt numb, everything felt amazing, and I was like, this is it. This is my time. At the time, I had a job, I had a car, and I quickly lost both, very quickly. 6 months later, I started using methamphetamines. 2 years later, I started shooting up and things just went downhill fast. I started doing criminal activity to support my habit. I mean, it started with like petty shoplifting, you know, what have you. And eventually I was selling drugs to support my habit. It's funny because throughout my 8 years of addiction, it always centered around an unhealthy partner that I seeked validation in, right? I had no way of internally validating myself. So I looked for it outside of myself. Shortly after I started using heroin, I had that dream. Sexual abuse came back to me, and it didn't do well. I was trying to understand so much. Why is this happening to me? Why is this thing that I love so much been taken away from me? And I couldn't understand it. So I numbed it. I numbed the pain. I numbed the feelings. I didn't want to deal with it anymore. And I get emotional because to this day, I haven't really fully dealt with with that loss of my gymnastics career, of my athletic career. I still haven't fully dealt with it to this day. So the whole 8 years that I'm in addiction, my family got the worst of it. Friends, they were fair weather. They came and went. Using buddies, we called them. Those unhealthy partners came and went. And my family was there throughout it all. And as somebody that grew up with a core value of family and like closeness with your family, I broke that relationship. I broke the trust in that relationship. I broke everything in that relationship with my parents and my brother. There's a time that really stands out. You know, it's not the 16, 17 times that I got arrested. It's not the times that I said that I was going to do this and get clean once again. It's not all that. It's my brother took me to treatment one time. I had decided, right, that this was it once again. My mom didn't want anything to do with me at that point because I had broken that trust so many times. So my brother was like, okay, cool, I'll give it a shot. You sound like you're serious. And we go to the treatment center, and everything's great on the way there. You know, we're driving, listening to music. He's like, you got this. I'm so proud of you, sis. And we get there. And in the 10 minutes that it took for them to come out and get me, that was 10 minutes too long, right? I think I probably waited about 9 minutes. And I just turned to my brother at one point and I'm like, you know, I don't think I'm going to be here. I don't think I'm going to go. And he laughs because he actually thinks I'm joking. And I was so serious. In my mind, I'd already made up my mind, right? I know my drug dealer lives right down the road. I know I can walk there. You can leave. It's a done deal. And my brother's like, if you do this, you're not my sister anymore. But in that point, addiction has such a strong hold on me that it didn't matter. Anybody could have said anything and it wouldn't have mattered, to the point that I get up and I leave. And my brother comes up into the parking lot from behind me, just bear hugs me. And he's like, please don't do this. And I have to. I told him I have to. He's like, I'm going to call mom. I'm like, call her. So he calls my mom and we're in the parking lot and she's like, Antoine, just let her go. She was done. She was done with me. She understood that she had to love me from afar, right? So I go. I didn't go back to treatment that time. The intervention, the final intervention for me was going to jail on those 2 felony warrants and the nurse telling me that I was pregnant in jail. They started me on methadone right away. Could have been very harmful to my baby if I went into opiate withdrawal. So they started me on methadone, and that was the most bearable detox that I have ever experienced in jail. It made all the difference. I was in jail for a month. In that month, I had my first court hearing and thankfully was introduced to King County Drug Diversion Court, a therapeutic court. And there, I saw this as my chance to get out of this lifestyle and to deal with everything that's going on inward and to give my child this life that I didn't want to escape from, that I didn't need to escape from because I was happy. I wanted to find that happiness and pass that joy on to him and have a happy, healthy baby, right? That's what I wanted. And that's what happened. But I'll never forget, I called my mom from jail that day that I found out. And I told her, hey, mom, I'm in jail again. And oh, by the way, I'm pregnant. And her response is, you can't have this baby, right? And why wouldn't it be? She's fearful. She thinks that she's going to have to take care of my kid, that I'm going to get out and do everything the same. But that's not what happened. I got out and I gave myself a chance. And thank you to the support of King County Drug Court and to my case manager who connected with me. My son saved my life. Drug court gave me my life back. They showed me how to live as a productive member of society, right? And thanks to all the support that I had and the willingness that I had to get out of this lifestyle, I was able to, I'm able to show up today to share my story with everybody, right? This thing that used to be so shameful and so full of trauma, I'm able to use that to instill hope in others today. And that's a beautiful thing. It's, before I started working here, I actually started coaching gymnastics to little kids at the same gym that I went to when I first moved here. And it's just crazy how things come full circle, right? And it was a reminder that I'm right where I'm supposed to be. And it gave me a chance to keep me close to this sport that I loved and that gave me so much. And again, I get to pass on my skills. And my joy of the sport to these little kids. My son's going to be 4 on Monday, and he gets to never see me loaded. He gets to never see me high. He gets to grow up with a present mother. His name's Liam, and he's my pride and joy. And I talk to him about this stuff. You know, I keep my mugshots, one of my mugshots at my office. And when he comes and sees me, he's like, Mama was in a dark place and I pulled her out. And he knows that. He knows the impact that he had on my life. And it's so important to share our stories with people so that they can understand that addiction, in my opinion, stems from trauma. And these traumatic events that we experience in our youth as a child, even in our adult life. Addiction can start much later in life. And we have to recover out loud. We have to inspire people. We have to give people hope that there is a way out. I'm really grateful for every opportunity that I get to do this. And I thank you all for being here.
We thank you. Thank you so much for your vulnerability, for your spirit, and for just being who you are, Marjorie. And happy birthday, Liam.
Thank you.
All right, I'm going to hand it over to Chelsea and Ash.
Hi, everyone. Good morning. Thank you so much for having us. And thank you, Marjorie, so much for telling your story so beautifully and being so vulnerable with everybody. This is what it's all about, right? Is sharing our stories and helping people understand and connect to this issue in a way that helps people rise. There's a lot of love that needs to happen in this space for people to heal. And we're going to talk to you a little bit about what we do today, about, I think, one tool that we have around opioid use and pregnancy that can really help provide some of that love and support in folks that folks are looking for. My name is Chelsea Porter. I use she, her pronouns. Ash Woods is here with me. Hi, Ash. And we're going to dive in a little bit about what the Harm Reduction Doulas do as a framework and talk about a little bit of our work as Harm Reduction Doula Collective. If folks have questions, please feel free to drop them in the chat and we'll try to get to them as we present. We're going to do it real casual today. So we'll dive in.
Next slide.
Thank you. So today we're going to talk a little bit about the role of a harm reduction doula and what our scope looks like. We will talk about some of the concrete steps that we take to try to reduce preventable deaths and improve care for birthing people who use drugs, and then talk about some best practices that we've implemented for supporting pregnant and parenting people who use substances. Next slide, please. So to introduce the collective, we call ourselves the Harm Reduction Doula Collective. I want to highlight that there are lots of people throughout the country who are doing this work in some form or another. There's Project Nurture in Oregon. There are doulas down in LA, the Needle Exchange is down there who are interested in doula work. There are folks in Chicago. There are folks in Europe. There are people all over the country doing this, and we are just one tiny collective of doulas who do this work, and we all do it a little bit differently. So we will talk about what we do today, but I highly encourage you to check out other folks and check out people in your area who do this work to see how you can support them. So in our collective, we provide harm reduction services mostly in Seattle, Washington. We work through King County, Washington, and then a little bit north and a little bit south. And what we do is we work with parents and families who use drugs. We work with pregnant people who use substances, parents who use substances. We also work with people who are in treatment programs, outpatient and inpatient, medications for opioid use disorder programs, people who identify as being in recovery. And we provide full spectrum doula support and community resources, which means full spectrum, for folks who aren't familiar, means that we provide support regardless of pregnancy outcome. So whether pregnant people wish to parent, wish to seek an abortion, wish to pursue adoption, whether folks are separated from their family by family separation systems, people who have miscarriages, regardless of the pregnancy outcome, we provide the same full spectrum support. And a lot of our work is connecting to community resources and connecting to safe community resources for people who use drugs, and we'll talk about that. All of our services are free, and we also provide harm reduction training. We do a lot of talks like this, talking to folks about harm reduction, drug use, harm reduction doula work. And one of our big goals that we haven't realized yet is actually, getting involved in training the folks that we work with as doula parents, to support them in their journey to becoming doulas as well. And I'll give a shout out to one a little bit later today. Next slide. So what is a doula? I can't see anybody's hands. I usually like to ask people to raise hands if you know what a doula is, if you've had a doula, if you have a family member who's had a doula. Who knows what a doula is?
Yeah, please. Yeah, we got some thumbs up.
Yep, seeing some. Awesome. Yeah, so doulas is kind of a newer word for a concept that many communities and people have been doing ancestrally for generations. So doulas are birth workers, support people throughout their pregnancy and postpartum and parenting journey. We provide information, emotional, and physical support for birthing people and their families. For harm reduction doulas, we typically start working with people during pregnancy, but that could be literally during labor and delivery. But we usually work with people during pregnancy, throughout labor and delivery, and then for about a year postpartum. We are not medical professionals. We don't provide any clinical services. People always ask us if we catch babies. We don't do that usually. But we do provide a lot of informational support about pregnancy, about birth, about parenting, and what's happening. And anybody who has a doctor in the US knows that when you go to a doctor's appointment, you have about 7 minutes to tell them everything that's going on with you, and you have about 2 minutes to understand it when they give you the information back. And so I think we provide a really great supportive role to medical professionals to help people understand very clearly and with consent what's going on with their bodies, what's going on with their pregnancy, and how they can make the best decisions for themselves and their family. In Washington State, there's no official doula certification, but there are many trainings, many continuing education opportunities that doulas engage in to stay up to date on birth and postpartum and pregnancy practices. And there is a lot of evidence that shows that doulas improve outcomes both for birthing people and for babies. Next slide, please. So what is a full spectrum doula? I got ahead of myself in the slides here. But I think it's important to know that some doulas there's doulas for lots of things. There's abortion doulas, there's labor doulas, birth doulas, there's postpartum doulas, there's gender doulas, there are adoption doulas, there are tons of different types of doulas. And we often say in the doula world, there's a doula for everybody. So if you're looking for something specific, there's often somebody out there who provides it. But like I mentioned, full spectrum doulas provide support for all reproductive care outcomes, prenatally, throughout labor and childbirth, after babies are born, miscarriage and stillbirth, abortion, any loss, and then care for, like I mentioned, not reproductive experiences. And something I want to highlight here, particularly around the postpartum period, is that when we look at the maternal mortality reports in Washington, and I think in much of the US, overdose is a leading cause of pregnancy-related death in the US and in Washington. And in Washington, many of those deaths occur after 6 months after baby is born. So from that period, from 6 months to a year. And so we really want to challenge people to rethink and to reconsider what the postpartum period is and how long we support people after babies come. Next slide, please. So we are harm reduction doulas. We started this work, our little group, in 2020. All of us were working at a local needle exchange called the People's Harm Reduction Alliance, and we were doing street outreach to provide harm reduction supplies and resources to people living literally unsheltered, people who are using drugs. And through that experience, in addition to the dire need that we see for folks to have access to housing, access to harm reduction supplies to keep themselves safe, access to treatment, we saw that a lot of the folks we were working with were also people who were pregnant. And so we just started providing doula services during our outreach. We provide, like I said, full spectrum care. So regardless of pregnancy outcome, we support folks. We provide harm reduction supplies, so safer injection supplies, safer smoking supplies, naloxone. And we have a lot of knowledge around how to connect to treatment programs, how to connect to supportive services, information about like medications for opioid use and pregnancy and lactation, body feeding, you know, a lot of stuff that you would think that a lot of providers would have really good knowledge about, but what we find is that a lot of providers have very little knowledge about how to care for pregnant people who use drugs. And so we do a lot of advocacy, a lot of ensuring that people have access to body feed and breastfeeding if they want to, a lot of advocacy around pain management for people who use drugs during labor and delivery, which they absolutely have a right to and are often denied. So a lot of kind of niche information around drug use and pregnancy and how we can best support people throughout their experience. We do direct outreach to people to engage them in services, and then we provide transportation, which is a really significant need. Transportation to appointments, transportation to baby visits, transportation to family. I think transportation is one of the biggest needs that our folks have, and so we do a lot of direct support in that way too. Next slide. So Ash, do you want to speak to this at all? I can keep.
You're doing such a great job. Yeah, I think one of our biggest things that we do for people is help them understand the risks, the benefits, and the alternatives, and really empower them to use their voice and just like bear witness and try to set them up for success. And a lot of that is done prenatally or during labor and delivery of just giving them all the information they need and the evidence that is out there. And some of that is around creating like safe care plans, knowing our experience working with like CPS, DCYF here in Washington, just like what the procedures are and what to expect and how they can prepare and get their place set up, make sure they have everything they need, as well as like educating community on like resources that they could provide for people or ways that they could reach out and better support. Next slide. Barriers to receiving care. Kind of have this thing that like doulas are kind of a luxury. Luckily, Washington State has approved Medicaid reimbursement for doulas, but the average cost of a birth doula is up to $3,000, and postpartum doulas right now are even going up to $85 an hour. So we provide our services for free for people that are actively using in a treatment facility. Most of our clients are unhoused or unstably housed, including living in shelters. So we're trying to remove those barriers to create access points for people who may not have the financial means to afford a private doula. Next slide. Barriers to receiving care. This is like, we could make pages and pages of lists that we've encountered working with clients. When we take our clients to a hospital for a prenatal check or the doctor's office or a clinic, they're given a lot of expectations or assumed kind of like, you know, call this number, you know, or be at this appointment at this time. And a lot of folks just don't have reliable communication. Their phones might only work if they're connected to Wi-Fi. They only have so many minutes on their phones. They have financial barriers. When we talk about transportation, a lot of them are relying on public buses. If you're pregnant and you have to ride a public bus all over town to get multiple appointments, say you're going to the methadone clinic and then you have to be at a prenatal, and you know, a lot of folks have like a lot of comorbidities when they're pregnant, so there might be additional needs for medical care. And they're spending most of their days like riding all over public transit, pregnant, no access to a bathroom. Are they eating? Do they have nutrition access? Like, do they have enough money on their food stamp cards? So like a lot of our, like we look at a lot of these barriers. Some of them don't have necessarily partner or family support, or they're in a dangerous situation with their partner. If they are in active use, accessing supplies, or even if they're in treatment, like just needing, whether it's like supplies for themselves or for baby, personal hygiene, struggling to get a place in a shelter. They might be houseless and they're on a wait list, or they're in a shelter and can't get into housing. Next slide. Yeah, Chelsea, do you want to also jump in on this?
Yeah, I think those are all, I mean, Ash spells them out beautifully. And I think what I want people to understand is really the reality of being a parent who uses drugs, who may be unhoused, who may be going through a process with CPS or DCYF. Like literally, we have had clients who just gave birth by C-section the day before be asked to bus across town multiple times per week to provide a urine screen for drug testing, while also caring for their babies, while also trying to find housing, while also trying to feed themselves, while also trying to heal. And I think what we do as doulas is really reiterate to people that, like, not only is this person a whole human who loves their kid and who's trying their best, but they are a postpartum or a pregnant person who has specific physical needs, specific emotional needs. And when we don't care for people, that is how we end up with a maternal crisis, mortality crisis that we have. So I don't know that unless you do this work, you can really understand the significant barriers that are stacked against people just to stay with their babies and just to stay healthy. And we as doulas try to pick apart those barriers the best that we can. And when we can't, advocate for a system that supports people better. Next slide, please.
I also just want to point out the biggest one we run into is people going to their methadone dosing. Just having a baby, a newborn, struggling with transportation, being exhausted physically. Maybe they just had a C-section and they're expected to show up to get to the methadone clinic within a small time frame, carting a baby. Sometimes they can't even carry the carrier to get the baby like into the van or however they're getting there on the bus. It's just like our expectations we have for people to remain in treatment. So that's where we see it. The highest return to use is missing those dosing appointments early on, shortly after birth. I think that's one of the things that we get called a lot for is like, my ride didn't show up, or I missed the bus, or I can't like carry the stuff. I need to get to my methadone appointment, and we're able to give them a ride, but that's a huge barrier right there of like our expectations and why we're not making that more accessible. Oh, sorry, go ahead, Chelsea.
Oh, thanks, Ash. And I'd like to take it even a step further to say that if folks aren't familiar, in many other countries in the world, you can get methadone at the pharmacy like you can everywhere else. You can pick up methadone like your prescription you can anywhere else. So like the stigma and the barriers to care that people who use drugs face in the US are in some ways very unique because we have drug policy that unfairly punishes people. If you get methadone for a pain prescription in the US, you can pick it up at the pharmacy. But if you get methadone for opioid use disorder, you have to go to a special clinic at a special time every single day in a situation that is like full of barriers and a real lack of good care. So I just want to put a side note. Tiffany Colombini put in the chat, they work for We Care Daily clinics. We Care is amazing, run in partnership or run by the Muckleshoot tribe. I think, Tiffany, if you could confirm that. Yeah, go ahead.
Yes. Yes. I am so excited about you guys. Like, this is amazing. Is it okay if I just share a tidbit right now?
Absolutely.
Okay. So I am a peer counselor, and I specifically work with our pregnant population. And we have mobile units in Seattle and Tacoma. And what we do is we break down the barriers as well, right? So We Care is the only clinic that provides transportation. So if a patient is needing to get their doses every day, right, we provide that transportation. And when they're pregnant, we kind of go a little bit out of our way. Like we just do a lot more for our pregnant population. We have our groups that I run, right, to just provide the basic education, pretty much like what you guys do. We don't have a lot of people that join it, but even if it's just one person, I absolutely love it. And then working on, I specifically just help them meet them where they're at, right, and just provide education, connect them to resources. We are also open later too, until 8 p.m. So that helps. And then when it comes to like after delivery, if they just had a C-section, we kind of work with the counselor on and the provider and trying to get carries for them, right? Because you guys are right. Like it's too much for a mom to come in and be stressed out about how is she going to get her dose. So any barrier that comes up, we try and figure it out. And that's why I love working here, is because we have a voice. And if we notice something, or if, like, for example, if they need an ID to access services, okay, let's pay for it, right? Muckleshoot will do that. So if they need transportation, I'll go pick them up, right? Like, oh, they just gave birth, but they've been missing their appointments. Okay, well, what's the holdup? And so I'm able as a peer to go and pick them up if needed, or take them to their OB appointments. So I just enjoy my job so much. And yeah, I'd love to, if anyone wants my contact information, I'd love to give more information to you guys one-on-one.
Thanks, Tiffany. We'll send that out
Thanks
on the
for letting me
recap.
share. Awesome. Thank you.
Thank you so much. Yeah, We Care parks right outside People's Harm Reduction Alliance. They were sharing like space just to make it more accessible for people. And I really appreciate the work y'all are doing.
Oh, that's amazing. Oh, and one more thing. We're working with the Perinatal Harm Reduction Alliance on coming up. We're creating a book for Washington State. Because are you guys familiar with the toolkit? Yes.
The Academy of Perinatal Harm Reduction.
Yeah, they have that toolkit, and we're working on creating one specifically for Washington State. So we're super excited.
Thanks so much, Tiffany. And I don't have the internet skills right now to link to it, but I put the name of Academy of Perinatal Harm Reduction in the chat because their website's incredible. They have a truly harm reduction based guide for providers and for parents around drug use and pregnancy that I think challenges a lot of the misconceptions that we have about the physical impacts of drug use during pregnancy, which is a whole other talk. But what we know essentially is that racism and poverty and stigma have much more of an impact negatively on the health of pregnant people and their babies than substances do. And so highly encourage folks to check out that guide and learn a little bit about from all the research that they've done is really important. And thanks, Tiffany, for sharing. Also, just want to mention that the tribes are absolutely leading the way in caring for folks. As always, there's another clinic called Jamestown Healing Clinic that's run by the Jamestown Squam tribe out in the peninsula. And they also have a model for opioid treatment programs that includes transportation, that includes food, that includes more supportive care. They do HIV treatment, hepatitis C treatment, and very few other opioid treatment programs in Washington are following that model. So definitely want folks to look to the tribes to see how they're caring for their communities and the community more generally in a way that's really radical for the space. We got a question that says, are you all at the Harm Reduction Doula Collective connected with the Doulas for All Coalition, the group that is working on a bill legislation for this session and a Medicaid benefit for doulas in law? And I will pass that to Ash.
Yes, I'm like participating in meetings or been around in the vicinity. It's mostly queer, trans, like BIPOC led. And they have approved Medicaid reimbursement for Washington, but they are like kind of ironing out the details of what that's going to look like for licensure for birth doulas in the state of Washington. And they're like rolling that out right now. There was just a meeting, I think, last night. But that is coming. There will be Medicaid reimbursement for birth doulas and licensure for birth doulas in the state of Washington. I think there's some other hands up.
That's me. This is Beth. Is it okay if I clarify something around that? I work for the Healthcare Authority, the state Medicaid agency.
Yeah, sure.
Yeah, so we currently do not have a Medicaid benefit for doulas in Washington, and I think there's like a lot of confusion around that, and so I just wanted to clarify. I think it's complex and multifaceted as things are, but I think it's probably related to the fact that Department of Health stood up their credential process October 1, 2023, so just last month, and I think people erroneously ascribe that to a Medicaid reimbursement, but they're totally separate and distinct. So there is now a Department of Health pathway for doulas to get a voluntary credential. It's called voluntary because it's not that someone working as a doula, right, must have that DOH credential to call themselves a doula, but they do have to have it to call themselves a state certified doula. But the bill that the coalition, yep, they are absolutely Cutie BIPOC led. They are also open and welcoming to any and all doulas and stakeholders who want to work with them and care about doulas and getting funding for doulas. The bill that they are writing for this legislative session will be directed at the legislature for both a mandate and funding for Medicaid to implement a Medicaid reimbursement. Of course, lots of unknowns there, but if that bill passes the legislature, is signed into the governor's budget post end of session, there will be a runway that the Healthcare Authority would need to get all of this stood up. It's a lot to implement a brand new benefit for a brand new provider type. So the earliest that there could be a Medicaid reimbursement, and this is like really if all the rulemaking and everything with CMS goes smoothly, would be January of 2025 at the earliest.
Awesome. Thanks for that update, Beth.
Thank you. Yeah, I was like, everything's in the pipeline. I just know that I get sent all the forms to review and then like give feedback. So, and I know that we passed the approval, I think it was like last year.
So we have a couple more slides. That's kind of about stuff that you can do, but I just want to shout out to somebody who's on the call, and Sarah put her contact information in the chat, but Sarah Beauvais is on the call. She is a doula with Project Nurture in Oregon, which is a very harm reduction doula adjacent program. Sarah was actually one of my very first doula clients when she had her baby Ryan. And Sarah, I think, is such an incredible example of, someone who has lived experience, someone in recovery, someone who experienced houselessness, someone who experienced birth trauma, and has used all of that experience along with support and tools to become a doula and to begin, caring for her community in the way that only someone with lived experience can. So I love you, Sarah. I'm happy to see you on here. Sarah put her contact info in the chat. If you want to reach out and connect with her, especially Oregon folks, please do. Sarah's doing what we hope will happen is, people with lived experience will become doulas themselves and do this work better than we ever could. So I'm glad you're here. I know we got a couple minutes left. Really, I think all we want to highlight in these last slides is the first most important step in this work is examining your own biases and your own stigma and understanding, your beliefs about drug use, what cultural beliefs you've been told about people who use drugs. People who use drugs love their kids. People who use drugs are wonderful parents. A drug test is not a parenting test. And I think it's really critical that we think critically about the way we treat parents who use drugs and identify resources and that can truly support people instead of separating them. Ash, you want to say anything about this?
Sorry, I was reading the chats, trying to catch up on if I missed anything. I think there is like a request of like, how do we get doulas? And I think the biggest encouragement is if you're working for like a nonprofit or a small clinic or, anytime you can get grants or funding, writing in reproductive care as part of that. So yeah, when you're thinking of like your funding and your requests, putting in a little piece for reproductive care. We're seeing that in a lot of like syringe service access programs and stuff of just like, oh, we're like missing, like, yeah, we're providing condoms, or yes, we're doing this education piece, but thinking of more of like the emotional, like physical support side of care. We can hand out supplies to people, we can hand them out flyers, but what if they had somebody who could do warm handoffs that could walk with them through that journey or be with them at their appointments or have an advocate in the room with them if they didn't have a support person. So just like things to consider when you're creating positions, when you're asking for funding, is like creating a place for an advocate, a doula, or a peer support person. And then looking for programs that are bringing in people with lived experience, specifically like our speaker today. Inviting them into the room to share their experience or inviting them to companion somebody who is also going through something similar.
We got one more slide. Next slide, please. And this, I think, just touches on what Ash was just talking about is, the solutions for this crisis will and always have come from the people who are most impacted, and centering the voices of Black, Indigenous, queer, and trans communities And, you know, making sure that even if you're harm reduction, are you focusing on how people are impacted by mass incarceration? Are you catering services to sex workers? Are you focused on housing access? People do not live single issue lives, and we need to center the folks who are at the forefront of this crisis as we develop solutions. So, you know, I think we see this really obviously and dramatically right now with the combination of the criminalization of pregnancy and abortion combined with the criminalization of drug use, and how that impacts people and their reproductive outcomes. So if you want any resources or connections to people in your community, please feel free to reach out. If you have any questions for us, please feel free to reach out. That's our website and our email. And thank you all for having us today.
Thank you for being with us. We have a few minutes before our closing slides. We're just taking down the slide deck and opening this up. And yes, applause, 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 lots of love. Who would like to comment, ask a question, or share a resource? Welcome, everyone. Hi, Sarah. Nice to see you. How has a doula impacted your community, or where do you see the work in your community? Hi, Farai. We will certainly include the links that were mentioned, Jamestown Healing Clinic, the We Care Daily, just for best practices, and the people that have so graciously offered to connect with you all. Thank you so much for that. And we'll go ahead to our next slide. You will get an embedded link to this presentation as well as the slide deck. And we'll, on the recap, we'll include the links that were mentioned. Please join us in December. I can't believe it's going to be December. What happened? Next month, we will have Marjorie again, who does a lot of work currently in the corrections, in correction organizations. Lieutenant Jeff Gepner is with the SCORE jail. He will be co-leading with Marjorie in December. So please join us. Same link, same time. And next slide. We have, you're going to see a link right now in chat. We very much would love to get your feedback. If you could just open that up. There would just take a couple minutes to answer questions. You'll also be getting this on an email. We really look for the remainder of these sessions to improve how we deliver material. If you have ideas for our next iteration of this series, we would love to hear that. We are a quality improvement company, so we do try to practice what we preach and to get better in how we deliver our material. So thank you so much for your feedback. Next slide is a big thank you. We know that your time is precious, and especially to Ash, Chelsea, and Marjorie, thank you for your witness, for your vulnerability, and for the tireless work that you're doing to help others and to share your stories and to just create community. Thank you, and we will see you, we're finishing a little bit early, and we will see you next month.
Thank you.
Thank you.
Thank you. I'm getting the recording, right?
You are getting the recording, correct?
Okay, thank you.